Well, thank you, Mr. Meadows. And just following up on that, I think, and we talked about this when we met at the facility a couple of months ago. I think because of the unique nature of this facility and the problems that have plagued it in the past, we've got to create a matrix for setting goals that have been set certainly by the IG's office and meeting them and institutionalizing so that, God forbid, but you're hit by a bus tomorrow, your successor has to follow through and has that in front of them. And remember, we're doing all of this for our veterans to make sure they are best served. So, I'd like you to give some thought about that, because I think we want to institutionalize following your progress. This is not going to be a one-time hearing. And we have a model we've created for IT in the federal government with 7 factors, and we grade, and we're going to have a hearing on that next week if you want to see what it looks like. But we'd welcome your suggestion on that, and yours as well, Mr. Missel. Let me ask you, you're the IG, and you talked about a culture of complacency. Could you tell us what you meant by that? What led you to characterize activities at this facility as constituting a culture of complacency?
What we found is that the problems that we identified were pretty well known throughout the facility, that a number of staff raised those issues, did not get them resolved, did not get them worked out to their satisfaction, and rather than working harder to get them raised either to our office or others who could do something about it, that they just decided they were going to live with them and have workarounds so that they could make sure that the patients got the best quality care under the circumstances. So they just were satisfied because they felt they had no other route other than try to get the best quality care for the patients.
So what you've just described is sort of institutional barriers to providing quality service, and they did workarounds to try to give that quality service, the barriers within the system notwithstanding.
They felt leadership was either not listening to them or not taking appropriate action, and so they felt that there were no other avenues to pursue.
In some cases, however, I mean, for example, we had a case where I think, if I recall, the blood supply had to be destroyed because it had not properly been stored. Is that correct?
I believe that's correct, yes.
Is that a function of management or a function of maintenance and making sure things kind of work properly?
It has to do with the leadership at the facility across all departments and all levels. And they have to understand what they're supposed to do, be properly trained, but then if there's an issue, to raise their hand, not be afraid to raise an issue that if they do, that they'll in some way be retaliated against. And that's one thing we found at the facility. A number of people who didn't raise their hand felt that if they did, there would be retaliation against them.
Mr. Heimel, would you agree that that was a problem when you took over, that raise your hand and be empowered and there's no retaliation based on what you report? And what have you done to change that and encourage it?
Sir, it was a problem when I arrived at the facility, and quite honestly, there are still pockets of that fear across the organization today. And the only way that we can really overcome that is by demonstrating that leadership takes those concerns seriously. We're going to address them, and we actually say thank you to people who bring them to our attention and recognize them publicly. Reward the type of behavior from our employees that we want to see.
Well, both the ranking member and I spent a lot of time in the private sector, and one thing I think both of us would observe is, and you had a line of questioning that got to that, but it's what's rewarded. You can say all you want, but if people notice that's not what's rewarded, and in fact, it could be punished. It's not going to change behavior. So presumably, you're looking for some high-profile opportunities to show you are committed to what you just said you're committed to.
Yes, sir. I try a couple of times a week to send out a tell me something good story to all the staff where either a veteran has thanked somebody for doing the right thing or going above and beyond, or a staff member discovered an issue that they raised and they prevented a problem from happening. I would like to be able to do those every single day, and I would like to have a weekly Good Catch Award where we could recognize somebody. Unfortunately, the challenge I have right now is we still tend to focus on the negative event and not finding those positive events where we should be recognizing those behaviors.
Right. Presumably, there's an in-between where we reward someone who takes the initiative to avoid the negative happening, and that's a positive.
And that's exactly what we have to have in healthcare if we're going to become high reliability organizations.
Let me explore the issue of HR. HR is the number one office still with a 68% vacancy rate. So out of 78 designated positions, only 25 are on board, 53 are vacant. What can go wrong with that, Mr. Missel? That high vacancy rate in an HR office?
What could go wrong is you're not going to be able to hire the people in the other departments and divisions that you're going to need. And that was what we found when we came on site at DC, is their HR department was so broken that they had outsourced it to the Baltimore Medical Center. So the Baltimore Medical Center HR department was not only trying to staff Baltimore, but DC as well. And without effective HR, it is extremely challenging to make sure you have the resources and the staff necessary to do the job necessary.
So HR is kind of key to an enterprise. If you want to hire, you want to have new hires, they got to be processed.
Absolutely.
HR does that.
Absolutely.
If